Good evening, everyone. And a special good evening to the people of Bermuda, and a special thanks as I begin this remark on our frontline healthcare workers, all our emergency services, and all those who are doing so much over the past few weeks to make sure that Bermuda is equipped to handle this global pandemic. As we look around the world, healthcare systems, governments, and communities are fully engaged in combating the most significant pandemic in this modern era. Almost hourly, we can see the consequences of this aggressive virus on the global community and the world's economy. Borders do not constrain this impact, and as a planet, we are engaged in a containment of transmission. Here at home, we have taken unprecedented steps to protect all of Bermuda, and especially those of our citizens who are seen as the most vulnerable. In a few moments, the official record of test results will be updated to reflect that Bermuda now has 6 confirmed positive cases of COVID-19. Out of the 4 additional cases, 1 was a close family contact of a passenger on the BA flight on the 8th of March, and 1 arrived on the BA flight on the 17th of March. 2 people arrived in Bermuda by a private jet. So those are the 4 new cases. If you were traveling on either of those British Airways flights, either on the 8th of March or the 17th of March, here is what you should know. For those of you who are on the 8th of March flight, your self-monitoring period ends today. If you're on the flight of the 17th of March, your self-monitoring period ends on March 31st. If you have not been unwell during this period, there is nothing else for you to do. If you have any respiratory symptoms or are feeling unwell, contact your doctor. Explain that you were on one of those flights and you want medical guidance. Do not go to your doctor's office or the hospital. Please call ahead. Earlier today, I met with the medical leadership of the Ministry of Health, the hospital, and the local testing facility who is conducting our local testing here on island. The ability to test locally is adding a critical piece to our ability to isolate cases of COVID-19, trace any contacts, and most importantly, enforce a regime that will limit any possible community transmission. Just as this new and complicated disease, the testing regimen is a complex one and one that is in short supply the world over. As I indicated previously, we have received a limited number of testing supplies, and there are more on the way. However, this is a simple reality. The more we test, the more we know. And it is expected that there will be more positive results in the coming days. The issue is not whether or not there are more positive results. The issue is how do we handle those? Our healthcare professionals have significantly increased the number of tests that are being conducted locally, and by extension, this will allow them to trace the contacts of those persons who were found to test positive for this virus. Thus far locally, we have tested 41 persons. We are awaiting the results of the last 30, which were done yesterday and today. However, on the first round, 11 were tested, and there was only 1 positive. Though I am confident of our ability to test will help us contain the spread, healthcare work is only one part of this. We must mount a whole island effort to make sure that we contain this virus. The term social distancing must be taken seriously, and observing these new rules of how we interact with one another will save lives. The Minister of Health signed an order on Friday closing schools, and that applies to all schools and nursery schools as well, tourist accommodation, swimming pools, gyms, beauty salons, spas, and barbers, as well as church services except funerals, sports club activities, and concerts with more than 50 people. Following today's results, to further reduce the risk of community spread, the Cabinet, which just concluded its meeting, has approved the following further actions with effect from 5 p.m. tomorrow, Monday, March 23rd. The Minister of Health will extend the closure order to include all retail stores, cinemas, bars, and restaurants will be officially limited to takeout service only. Enforced social distancing will now be limited to gatherings of no more than 10 people. The Royal Bermuda Regiment and the Bermuda Police Service will be engaged in operations directly aimed at enforcing required quarantine of persons who arrived in Bermuda since the 17th of March. Again, that is, the regiment and the police will be actively monitoring those persons who are on self-quarantine. Essential businesses only will be permitted to open and will be required to adopt the aggressive social distancing guideline now in place and on reduced hours. These businesses are banks, food suppliers or supermarkets, pharmacies, and gas stations. These outlines and guidelines have been taken from best international practice as recommended by the Pan American Health Organization. It is very important for Bermudians to note and remember that penalties are enforced for any breaking of mandatory self-quarantine, and those penalties are a fine up to $6,000 for a first offense, and in the case of a second offense, a fine of up to $10,000 or imprisonment for a term not exceeding 3 months or both. I can also advise the Cabinet met today and approved the package of unemployment benefits to be provided to those of our citizens who are out of work as a result of this pandemic. The full details will be released to the public tomorrow, but I can say that the unemployment benefit will be for eligible employees not currently on financial assistance and will provide a payment of 60% of gross earnings up to a maximum of $500 per week. There may also be the opportunity to engage unemployed persons in some of the administrative tasks which are necessary to stay on top of the fight against COVID-19. With some clear basic training, some of our people who are not working right now may be able to assist. And I think it's important that we recognize that this is akin to a community effort, and this all of Bermuda is fighting a battle against the COVID-19 virus. So what I want to remind Bermudians, and this is very important, if it is not an emergency, an absolute necessity, or if you're not required to go to work, meaning that you are a part of an essential service or an essential activity, stay at home. Check on our seniors by phone or some other means that does not bring you into contact with them. If you are self-quarantined, stay there. Do not leave your home or wherever you are quarantined. Though the Minister of Finance would welcome the additional $6,000 to Treasury, it is not worth putting the health of this country at risk. Wash your hands, wipe surfaces frequently, and make sure that you keep your social distance. It is important to note that this virus is spread by respiratory droplets, which may be on surfaces or which may be by persons who are sick. And that is the reason why we say persons that are sick, if you are coughing, stay at home and contact your doctor. But it's important for everyone to remember that it is also flu season, and so we will go through the requisite checks. It is important to note, 11 persons had enough suspicion that doctors had that they were tested, and only one of those persons were positive for COVID-19. So it is not incredibly widespread, but we are taking these actions to make sure that we take the time to allow our testing to catch up to where we are so far in the community. We are a communal and tactile people. We think nothing of gathering for lunch, happy hour, or sometimes to visit. As those interactions usually come with handshakes, hugs, and kisses, we just cannot do that right now. We must adjust, and we must continue to adjust immediately. This new normal may include the term distancing, but given the united effort required, it can serve to bring us closer together. It's important to note that these new measures that were announced today are to ensure that we can continue the aggressive testing of which we have started. And internationally, the World Health Organization and others have shown that if you do aggressive testing and aggressive contact tracing, you can break the chains of transmission. What Bermuda and the example of what Bermuda is trying to follow are the countries that have been successful in controlling the spread of this virus. References to Hong Kong, Taiwan, and Singapore. We have the ability to aggressively test here on island, and we are going to make sure that we continue to aggressively test to make sure that we can control the spread of this virus. I will give a few updates from the Emergency Measures Organization, as there are some topical matters that I'm sure people would like to hear about. Earlier today, there was an announcement from the Ministry of Tourism and Transport that the Federal Aviation Administration in New York's Air Traffic Control Center temporarily suspended aircraft approach and departure control services. Air traffic is presently unable to operate in Bermuda's airspace, and this means that flights are being rerouted through our airspace, or around our airspace. This service, which is essential for flights to safely arrive and depart from Bermuda, has resulted in today's Delta Airlines and WestJet flights departing for Bermuda from Atlanta and Toronto, respectively, being canceled. The temporary suspension of aircraft approach and departure control affects all aircraft departing and arriving from Bermuda. However, it has been noted that we've just been informed that that service is expected to resume at 7:30 a.m. tomorrow, which will not affect the inbound cargo flights, which are expected to be arriving tomorrow. Government will continue to provide reduced operations at the airport until that particular service is resumed, but I'm pleased to note that we did receive a notice that that service will resume tomorrow morning at 7:30 a.m. On to the matter of education. Our public schools will launch a remote learning strategy in the upcoming week with options for a variety of learning activities for our students. These include learning packets, engagement using various learning platforms, the use of online learning applications, posting of information on school websites, and various means of communication with parents and students. The Department of Education has started to send out surveys to its key stakeholder groups, which include department staff, parents, and teachers, to find out if there are any technology challenges that persons may have working remotely. Stakeholders are encouraged to respond quickly to the survey, as this information will help the department understand what further support our private sector partners may be able to provide. The department thanks the 612 parents and guardians who, since 4:30 p.m. today, have provided feedback to the survey. The Department of Education also emphasizes that although school buildings are closed for delivery of educational services to groups of students, teachers and staff who prefer the faster internet at school or those teachers who have limited data at home can work from their respective school site while ensuring that they practice appropriate social distancing. The Bermuda Hospitals Board has indicated that in keeping with best international practices to protect all staff, KAMH has implemented a no visitor policy except in the following instances: the partner of a woman who has given birth, the parents or guardian of unwell children, and close family members of those who are near the end of life. These restrictions are in place to help ensure the health of medical professionals and to keep COVID-19 out of the hospital and away from patients. The public is asked to help keep public areas and lobbies at the hospital as empty as possible and to practice social distancing at all times. Anyone who needs medical attention should contact their doctor first, and if they need to go to the hospital, call ahead. Of course, if you have a medical emergency, please call 911. I would just like to add that I am certainly confident of the preparations that the hospital has made for this particular virus. I am comforted to know in discussions with the top brass of the hospital that they have procured medicines in advance which have been known to be very effective at treating COVID-19, and I'm certain that if cases end up being hospitalized, then we will be able to effectively treat them. I think, however, that it's important to note that out of the 6 cases here on island, no of the cases have required hospitalization, and I think that that is a very important point. The coronavirus itself is something that will spread through our community. Our job is to make sure to limit that community spread. Most of the symptoms are mild, and most of the persons who are impacted are mild. And I would like to say that many of the persons who have tested for this virus, or we know to have this virus, have recovered. The Bermuda Hotels Association today indicated some 1,400 hotel employees have been made redundant as a result of property closures. Tomorrow morning, when the Minister of Labor, Community Affairs and Sports outlined the criteria for eligibility for the unemployment relief benefit, those hotel workers will receive their funds so they can continue to live life during this very difficult time. The COVID-19 helpline was launched at the end of the week and the end of last week for members of our community who have questions and concerns. Some 400 calls have been made to the helpline since it launched last Thursday, and as a reminder, the phone number is 444-2498. Again, 444-2498. On the issue of social needs, the government is liaising with third sector and registered charity partners to coordinate and provide assistance to those members of our community who require additional support. These activities will be coordinated at cabinet level by the Minister of Public Works, the Honorable Lieutenant Colonel David Burt. In closing, I want to say that this news that we have, that there are more confirmed cases, is not unexpected. And I will expect, as we are now making sure that we are being aggressive on testing, that that number will continue to rise. What is important and what must be recognized is that it is a responsibility of all of us to minimize community spread and to minimize any type of transmission which may be taking place. That means following self-quarantine, staying home when you're sick, maintaining good hygiene, and most of all, making sure that you contact your doctor if you are feeling symptoms. If, given the new testing guidelines which were put in place today at the meeting of healthcare professionals, where doctors are freely able to request tests for their particular patients, I do believe that with this new aggressive testing that we have here on island, we will be able to effectively control any type of local transmission. My job, our job as the cabinet and the government is to make sure that the country remains safe. And the best way for that to happen is for persons to follow the rules, make sure they observe what has been laid out, and together we will be successful in preventing a situation in Bermuda as we've seen in so many places around the world. So again, these aggressive measures are necessary, but they are necessary to make sure that we do not have to take more drastic steps later. Our job is to preserve life and to make sure that we keep our country safe, and I think we are on the road to doing that. And I want to thank the Minister of Health again for making sure that we are able to expand the testing criteria and making sure we're able to aggressively test. And I want to thank the Minister of National Security for his leadership of the special COVID EMO, making sure that we can get items in place that can help to serve to enforce the regulations of which have been maintained while also maintaining the communication for all members of the public. With that, I'm happy to take any questions that members of the media may have.